And joining me now, Texas Congressman Michael Burgess, who is also an MD. Congressman, thank you for being here. How are you, sir?
I'm well, Sean. Thanks for having me on.
All right, let me go through this step by step. We have the president saying in the unlikely event that Ebola comes here, we are taking the necessary steps. He prepared the nation for this. Then if you go back and you look at the comments, we know that the CDC director, Dr. Frieden, said essentially any hospital in the country can take care of Ebola. You don't need a special hospital room to do it. All you need is a private room with a private bathroom. He said that 2 weeks ago. On top of that, we have this nurse who did everything right, called the CDC, got approval to fly with a 99.5-degree temperature, and look what has happened since then. How can they keep getting all of this so wrong?
Well, clearly all of the statements from the middle of September are now non-operational, and it just calls into question everything that has been said since then. I have called for that when a patient comes in, Ebola is suspected, if the diagnosis is confirmed, the patient is isolated, stabilized, and then transferred to a center. The community hospitals, as we've seen, Presbyterian has had a tough go, but honestly, I don't know that any community hospital would have been in a better position than Presbyterian was. They're a big hospital, they're a good hospital, they've got a great staff.
Well, I would say that Emory in Atlanta seemed to do a better job, and I'm not saying that Dallas did anything wrong. I'm just...
But Sean, they had been preparing for this for some time. Tax dollars had gone in to the investment of this isolation unit, and that's what they're there for. That's what the American taxpayer has paid for. So I think the ability of taking care of a patient like this in a specialized center, and look, you wouldn't let a researcher research Ebola in a regular college lab. They would have to go to one of the 4 biolabs around the country, and the same is true with the patients, I think.
Congressman, later in the program, we're going to speak to some of the nurses. They're on the front lines of this. We have 2 healthcare workers now that have contracted the virus. The nurses are saying, this is their words, 3 of my sisters are nurses. They feel unsupported, unprepared. They feel that they were lied to and deserted to handle the situation on their own. Now, how could we get to that point? And do you believe that the CDC director, who's been so wrong up to this point, is up to this task?
Well, look, I share their frustration, and certainly from the beginning of this, it's pretty clear that the healthcare workers on the front line, 10% of the cases are healthcare workers, 56% of the deaths in Western Africa are healthcare workers, so they have a particular vulnerability. So I asked Dr. Frieden today, when there was almost a case that got to this country in July, did you sit down and do any kind of a table talk exercise, any kind of brainstorming as to what would it look like when an unannounced, unexpected patient walked in the back door of an emergency room, and as he saw, he couldn't or wouldn't answer the question?
Well, I saw a lot of ducking and dodging as it relates to that. You didn't really answer the question, though. Do you think he's up to this task, or do we need to bring in perhaps an Ebola czar that really understands the need to fix this problem?
Well, Sean, what I do know is we need a general in this fight. We're up against a very dangerous and very devastating enemy, and quite honestly, we do need a general. I think all of us remember the experience in Louisiana after Katrina. It wasn't until Lieutenant General Russ Honore showed up in town that things actually came to come back under control. The president has refused to lead on this. The country is looking for him to do so. If he can't or won't, put someone in the position who will.
All right, last question, Congressman. Should we implement a travel ban from these countries, as some 35 other countries have implemented? Number one. And number two, between ISIS and Ebola, does this not focus like a laser beam on the porousness of our borders and the need to secure our borders and make them secure?
Well, the travel ban should have been acted some time ago. The president has absolute authority to do this under the 2005 pandemic plan. The Secretary of Health and Human Services has the authority under the Public Health Act. So this should have already happened. I don't know why the president won't act. And as you heard me say in the committee hearing this afternoon, I recommended to the committee that they send a recommendation that the floor have a vote on this, and that we not wait till Election Day to have that vote. Yeah. It needs to happen sooner, not later.
Dr. Frieden's answer on that, by the way, earlier today, where he said, well, we need to know where the people are, was just absurd. We've seen what happened with just 1 patient getting into the country. I agree with you on the travel ban. Sir, thank you for being with us. Appreciate it.
Thank you.